Cramps during early pregnancy are felt during the first 2 weeks after occurrence of pregnancy. This is imperative with the development of a body which is under transformation for preparing itself to hold a baby, which is in the process of growth. Cramping. You may even have an inkling of starting your periods because you feel like development of cramps during each time of the month. You can examine in this article as to why you are experiencing cramping during early pregnancy conditions and also moot out a question whether your doctor should be talked about it. A woman's uterus is largely made up of muscle as well as various other tissues that allow you to expand upwards of several times of its normal size during the course of pregnancy. When you contract and become acceptable for offering birth conditions, hormones occurring in your body trigger these actions for bringing about birth conditions of the child successfully. Causes of cramping in early pregnancy are triggered by cramping conditions during the fertilization of the egg, which attaches itself to the wall of the concerned tract. This happens as a matter of fact within 8 days after the fertilization of the egg. For the experiences of some spotting or very light bleeding, these conditions can be visualized when they happen with a particular purpose. There is a process of expansion of another factor that creates in such stages that passes on a message from the uterus for the beginning of expansion. This is again caused by your hormones which pass on signals to the uterus for getting the process of starting, which are ready for the purposes of your baby's well-being. These cramps are akin to cramps which are felt during the PMS syndrome and post-syndrome. There is also normalcy of uncomfortable qualities which are normalized at later stages on a higher degree. Cramping also occurs during the course of pregnancy following sexual activity or by triggering the course of your bladder, which is completely impregnated with various ingredients. Sometimes the constant urination brings pregnant conditions which go side by side. With heavy bleeding. If you suffer with cramping, there is a need for beckoning a doctor, which is important for immediate attention. For many different purposes the issues could be diagnosed by a doctor for the purposes of deep investigation. Your uterus is supplemented by ligaments which are circular in nature. They continue to expand with your uterus by the process of continuous substantiating support. These expansions can also cause cramping of a degree which is of a lower level without using support of various tissues, the movements of which enable proper reduction of the so-called cramps. Treating cramps during early pregnancy can be combated by varieties of methods which are important for the purposes of these simulations, and for the purposes of guidance the following points can be given in a nutshell. You can take a pain relief medication which can be reduced by a process of proper alleviation of pain. You should not take any painkiller tablets during such conditions. You can always call and speak your doctor before taking any kind of administered medications. You can also use heating pad by putting on your lower belly for going a long way for reduction of cramps. You should get plenty of rest. This is an age-old remedy for bringing about reduction of various cramps. These cramps occur during the course of metamorphosis of your body, as well as a great deal of your body can bring the necessities of taking rest under such circumstances. Thus, to combat cramps during early pregnancy, you should also avoid resorting to sex. This also brings problems of constipation, for which you should drink a lot of water for the purposes of combating this issue.